Hi, class. Welcome to Module 11 as we discuss the profession of medicine. Interesting as we start looking at the development of physicians as a profession and how they've forced other people out of the healthcare profession as we go forward. Unfortunately, I don't have a lot of good videos to show you. In the past, I had access to films on demand at the university as well as some access to PBS series that was called Mercy Street to show you early doctoring stances. Um, Mercy Street was a highly rated series, but PBS, they need the money to keep going, and the show is now unavailable to people and ended after the second season. So, with that, we'll talk about what doctors are in this particular module, but I'm going to have you do something else. So, hold on as we start looking at some of the aspects. And I want you to think about these sociological pictures, especially the sick role, and how that helps establish the profession of medicine. So, doctors start gaining their prestige in the 20th century. Before that, healers, doctors, all of those things were not as powerful. In fact, we can think of those old westerns we watch and where the doctor fit. Education was limited. Oftentimes, a medical school was less than 3 months of schooling, sometimes a year. So very different patterns were in place. People were well respected, the healers, if we look at the American Indian tribes or other cultures that came into place, and those people were very important in the community. But medical care was often dangerous. So we look at the development of medical care, and we can, especially in our own past, look at doctors during the Civil War. They basically could amputate in less than a minute, or in less than a few minutes, they could amputate and move forward. And more people died from the surgeries that occurred afterwards, and the concern about we can see the concern right there related to the safety that came into place and the infection rates. Medical care was very dangerous and was unscientific. Learning about the body comes along in gradual steps. We see some of that move forward as they start to research things at deeper level. So, early surgeries at Johns Hopkins are a nice piece of what's shown in our PowerPoints this week as we start to see and even look at what the care is in place and the sanitation. So there was a rise of dominance that comes along with the establishment of the AMA. And we start looking at what needs to be in place and what truly makes a doctor. So by the 1900s, doctors gain control over healthcare. They take it away, and we're talking about basically MDs at this point. They're taking other doctors out of the pictures, other doctors that were trained in different manners. And we'll talk a little bit more as we go forward on that. Now, one of the big issues that came into place is the Flexner Report, and this was actually done by a sociologist. It looked at medical schools across the country, and it's a very interesting piece to explore. In the Flexner Report, it's found that schools were inadequate in their requirements and for facilities. And what happened after this report came out, the majority of those poor facilities closed, and those that rated high, like Johns Hopkins or Western Reserve, which is in Cleveland, those schools then gained that power. And so it resulted in these closing schools. Fewer people could become doctors. They became better doctors. They controlled the situation and they were focused. So by the 1920s, doctoring becomes a profession that has respect. It's not just the Dr. Barber pole look. Okay, so that when you saw the barber pole, you knew you had a doctor and you had the barber. And oftentimes they were the same person that comes into place. They were the person that would tie things together. So there were multiple things coming into place. So even as we look at these wonderful Hallmark movies, they kind of romanticize what a doctor becomes was in that time period, or any of those other shows. They did not have a lot of respect, and they did not earn much money. The dominance comes then in the 20th century as we start to see MDs especially gain control over the field of medicine. So, doctors gain their stance. We see the 1950s, doctors become very powerful. 1960s, the advances of healthcare come along, and medicine starts really changing at that point. At that time, the United States had some of the best medical care in the world, which has declined significantly since that point. And we see the change of public stance towards doctors. Doctors are privileged and honored, and especially MDs hold that reign over things. By the 1960s, we have social movements coming into place. We see the civil rights movements, the women's rights movement, the movement for changing even to free sex. As we start looking at that, these social movements start to question the authority of doctors. Are they actually making the best decisions? Do they know that as much as they think they know? How do we not know our own body? It's very interesting in this time period as we find that people start to mistrust doctors. Doctors don't necessarily value other professions. And so even the area of dietetics, nutrition, they feel that that has little value. And so you see this backlash starts to come up, and can we self-treat? Parsons is writing his sick role in the 1950s as he looks at that turning yourself over to a doctor. And we get this backlash coming back. Is that really the best way of treating things? So this power becomes devalued. And we see that moving forward within the process by the rise of government involvement in healthcare, the issues of requirements of insurance, the corporations that now own doctors, and most doctors are not in private practice anymore. But these are significant changes that start coming into place to affect the role of doctors. Now, interestingly enough, as we look at other things coming in place, we'll look at this in the next module, as we see other healthcare professionals come forward, but doctors had previously, during that heightened time period, MDs had basically forced DOs out of practice. They affected chiropractic doctors who believed that the issue was all involved in the spine, where DOs were the holistic issue of care. And basically, those schools had some real difficulties. DOs by the 1970s, where they had separate hospitals in the past, were now incorporated then into the medical process and allowed to practice in hospitals. And most of you probably don't even know whether your doctor is an MD or a DO or what the difference is. Actually, DOs have one more year of education. So, and they're licensed in the same manner, but we know the difference of chiropractic and other types of doctoring that was put to the side. So some interesting pieces as we look at the structure. So doctors have a set licensure practice. They dominate healthcare teams. They control. When you sit in a medical meeting, as some of you will that are in nursing or in social work, as I did, the doctors, even the team leader may not be a doctor. The doctor sets the demands often in times. The medical education in this country is structured over lengthy training, long hours, substantial debt, and it's important as we start thinking about where that power is. Now, we can laugh as we watch Grey's Anatomy and some of the antics that go on, but you can see the power that comes into place. Now, learning those medical values has been an interesting piece, and how doctors are socialized. And there has been in the past the need to emotionally detach from a patient, to be superior, to look at that model of the body and disease and ignore or some of those social conditions. And those were highly valued. Today's medical practice is changing, isn't it? In fact, even on the MCAT today, students are required to know sociology before they go forward, to understand the social conditions that come forward. And in many programs that have pre-med programs, they have a sociology class just similar to some of the things you're picking up here, but just for those in pre-med. Learning to understand the environment, that shift to new emphasis on that cultural competency, that shifting to patient roles and what they are and how to respect that right of independence. So there's been great changes within the medical field, but there's still a significant level of pecking order. So it's interesting. And I think the last slide is an interesting thought for you. If you've been appointed to this medical association committee, what would you look at reforming? So something to think about. So what are you doing this week? Well, obviously you're reading your chapter as it ties to this particular issue, but I put up just for you to see, not for you to read because it's well over 300 pages, the Fleckner report that was done for the Carnegie Foundation. Now remember, the Carnegie Foundation tied to also a university that scored well in the process. I'm asking you this week to look at the most recent episode of The Good Doctor. In the past, I have asked people to look at House and the domination that occurred, as I told you before, Mercy Street, to see what older doctors, how things developed. But I want you to look for the interactions the doctors have with the healthcare providers, as well as the fact that these are training doctors. Now, I did not assign a particular episode because the most current one from the week before is free to you at the website. So if you go to it, you'll be able to glean some of the input. Your discussion board for the week is exactly how we finish going through the module. So you're going to find that your discussion is from your module. You've been appointed to the American Medical Association Committee on Reforming Education. So I think that The Good Doctor will help you think about what things need reform, why, and how you might design it, and how all your thoughts fit together. With that, I hope you have a great week.